Hi, I'm SaraSylvester, and I'll be interviewing a first grade teacher on the ADHD misdiagnosis topic. What's your name?
Jane Sylvester.
Do you think misdiagnosis is an actual issue in today's society?
Absolutely.
Do you feel as if first graders are generally more hyper than the other grades that you've taught?
They are by nature because developmentally they have more energy and they're learning to control themselves.
Are you required by New York State to report to a parent if you believe that their child has ADHD?
We cannot suggest that any child has ADHD. However, we can suggest that their child has trouble attending to tasks and can be inattentive.
And if a child comes into your classroom that you are aware that has ADHD, do they get special treatment?
No, if it's a general ed classroom, they do not, unless they have a 504 or an IEP for some other classification.
Are New York State teachers allowed to suggest medication to parents?
Absolutely not. When parents ask about if their child is ADD or ADHD and they ask questions about medication, all we can do is refer them to their pediatrician and ask them to follow up with them.
Do you feel as if parents are treating their children with ADHD in order to quiet them or calm them down as an easy way out of raising them?
There are certain situations where parents are looking for validation for children that are not well behaved because it takes time to train a child to be behaved. So there are certain parents that do use it as a label and as validation for the way their child behaves. However, there are other children who truly have ADHD.
Do you have friends or family who you think misdiagnose their children?
Absolutely. There are people who do use that, and children have been misdiagnosed, unfortunately.
Okay, thank you, Jane.
You're welcome, Sarah. Good luck.
Thank you. Hello.
Hi,
What's your name?
Gina Sylvester.
I believe you just graduated from Iona College as an education major.
I did.
Did you learn about children who may suffer with ADHD or any learning behavior problems?
Yes, we did.
And what did they tell you to do when you experience a child in your classroom who suffers from these disorders?
Well, a kid who's already diagnosed usually has an IEP or a 504 plan. And a kid who isn't diagnosed, you can recommend to the parents that they look into their attention issue.
What's an IEP or a 504 plan?
It's like an individualized class plan for them, so they can work along with the class, and they have could be extra time on tests. It could be they have someone read to them. It could be all kinds of different things depending on what the disability is.
Have you ever worked alongside a child who suffers from ADHD?
Yes, I have.
And how did you treat him?
We used to do homework together, so it was like a struggle.
Did it take him extra time to do his homework, or was it hard for him to focus?
I would say it wasn't hard for him to focus, it was just harder for him to motivate himself. So had he been motivated, he would have in turn been focused to finish. So I think that they were connected.
So do you think he genuinely has ADHD, or you think he's just lazy?
No, I'd say he probably has ADHD, but I think lacking motivation is part of it. I think he relies on his disability more than trying to overcome it. He just kind of uses it as an excuse.
Do you think his parents also rely on his disability?
Absolutely.
Yeah, do you think they give him an easy way out of everything?
Absolutely.
Do you believe that misdiagnosis is an issue in today's society?
Yes. I think the biggest problem with misdiagnosis is self-diagnosis. Everybody's so quick to say, I have this and I have this without medically backing it up. I think they'd rather be diagnosed with something than work to figure out how they can fix an issue.
Do you think there should be a more in-depth test or scientific way to determine if someone has ADHD rather than just talking to someone about it?
I think so. I also think the first step would be to be stricter on the kind of medicines that are prescribed to people with such issues.
Do you think
It should be more difficult to get that kind of medicine, and in turn you'd have to have a more difficult analysis.
Right. Okay. Thank you, Gina, for your interview.
You're welcome.